Thank you for your patience. When was the last time a healthcare provider asked if you had been gang raped? When is the last time a healthcare provider asks if your partner chokes you? When is the last time a healthcare provider asks if you had been treated hurtfully as a child or neglected in some way? When is the last time a doctor or dentist asked if they could touch you before they touched you? My name is Elizabeth. I'm a 52-year-old privileged, white, straight, cis woman. Mother, daughter, sister, friend, partner, physician, woman advocate, and surgeon. When I was a medical student and in my OBGYN residency, several times I was solicited by senior physicians to have sex with them. One of them even threatened to have me kicked out of my residency program if I said anything to anyone. I had an 80-year-old esteemed gynecology professor pinch my butt. I had a surgeon in the operating room of a major teaching hospital throw instruments so close to my eye, I was afraid it was going to put out my eye. Welcome to the best medical school in the world. I was just a woman. I was just another woman. I was just another piece of ass. When I was a medical student, when I was a resident, when I was a professor, I always felt like I wasn't doing a good enough job, that I could have done a better job if I had just had a little bit more time and knew a little bit more about the person in front of me. And then I could do an amazing job for them. One thing that propelled me into this field, of course, were the things that I experienced, both as a child, as a teenager, as an undergraduate, as a medical student, as an OBGYN resident, and even the things that happened to me when I was a professor. I knew I wanted to be asked to be touched before I was touched. I knew that. It felt more respectful, because when we're not asked and someone just does something to us, even if it's in a medical situation, it feels like another trauma, another abuse, and especially for those people, especially women who've been hurt before. It's a pile-on of that feeling of disrespect over and over again. The current healthcare model, which I call Status Quo Health Care, is based on paternalism. Daddy's right, the doctor's right, the more senior doctor is more right. This paternalism pervades society, and we don't really think about it in healthcare, but it's there. Ask any woman who's been cut off when she's tried to ask questions, who's been made fun of for being a Googleologist by researching actual questions and topics before an appointment. This system, which I call Status Quo Health Care, does not have to be the model of healthcare. It's not medicine itself that the problem is. Medicine actually is amazing. We're going forward in medicine. We're learning new things. We're learning more about people. We're learning more about nanoparticles. We're learning more about how to treat people with respect. I created a new kind of model of healthcare, and I call it WomanSafeHealth, with safety in between woman and health. It, however, applies to everyone. Women just happen to be on the lower end of power in society. But it applies to everyone. Women, girls, trans and gender nonconforming people. Guys. When I was a professor, I came in one day at a major teaching institution to take care of Sonia. Sonia was in her 30s. It wasn't her first child. She'd had all vaginal deliveries. I came in with my 3 kids at home to spend time with her and to help her with her birth. On my way out the door, a more senior physician on faculty said to me, "You shouldn't come in for deliveries on days you're not really on call because you're making the rest of us look bad." He never asked me why. Why did I come in on my day off to take care of a woman who'd had plenty of normal births before? He didn't ask me because he didn't want to know. He was trained not to know and not to ask. On other occasions, I've been the patient. That's the interesting thing. We have to look at things from both sides. I'm not just the physician, I'm the patient. I'm also a woman advocate. A woman advocate is someone who supports other women, really other people, obtaining medical care. And why is that important? Because when we come to medical care, we're in a vulnerable position. We feel like we have less power because actually we do. We're relying on somebody else to tell us what's wrong with us. And we come with fear, we come with nervousness, we come with sometimes dread because we're not sure if we're going to be believed. We don't know if we're going to be thought of as hysterical or over the top. WomanSafeHealth is a model that focuses on welcoming people to medical care. It focuses on listening to the concerns of the client. Notice I said the client, not the patient. A client is the term we use for patient under WomanSafeHealth. A client is someone who seeks a consultant, someone in a non-hierarchical relationship, and who wants not to be talked down to, but be looked at across the aisle, in the eyes, and respected. A patient is a person receiving health care. A client is someone who has more power, and even if they don't know what their diagnosis is, wants to be treated with respect. Another part of WomanSafeHealth is belief, believing the person in front of us. We don't have to believe that every piece of minutia they're telling us is factually correct. What we're doing is believing their paradigm of living, believing how they experience their symptoms, how they are in families. This paradigm's very important to understand because many people look down, especially physicians look down upon clients who can't give an accurate history, or herstory, as I like to say. The other thing we all want in healthcare is to have our no respected. We don't want to just do what the doctor says. We have brain cells too, even when we're in the client role. And we may not want a medication because maybe our mother was allergic to that medication, or maybe I don't want to go to that hospital because that's where my grandmother died, or on and on. There are a whole bunch of reasons why when we're in the client role, we may want or not want something. And so I will propose to you that the model of care must include a respect of no. In society, this is exactly what sets up violence, is that the perpetrator does not respect the victim. They don't respect no. It's all about the perpetrator and their goals and what they want at the time. When I was a client at a Status Quo HealthCare institution, one that I actually taught at, I went in and I brought my husband with me. We sat patiently waiting for the doctor, and when she arrived, she stood up, put her papers on a podium. It was really a supply cabinet with lots of other things inside, and proceeded to ask questions. I interrupted her. I said, "This is my husband." She proceeded, I said, could you please sit down? I prefer to stand. I'm asking you kindly, could you please sit down? It really kind of bothers me that you're standing up and I'm sitting down. How long have you had thyroid problems? I stood up. I walked to her supply cabinet. I put my elbow on it, just like she was, and said, 21 years. Why are you being so combative? I preferred if you sat down, but you didn't. So I decided to stand up. How's that combative? When we're faced with these situations, which come out of the blue during a medical appointment, none of us expect to go into a medical appointment and necessarily be disrespected. Instead, we go thinking we're going to be treated well, thinking that the doctor will listen to us and believe what we're saying. But when we have an encounter, we always have to have our guard up. It's difficult to just relax at a medical appointment. All of us go in thinking, okay, how many minutes do I have with the doctor? Am I going to have enough time to get through the 3 things that I really need to talk about today? Probably not, because maybe it's only been designated for you to have 5 minutes. Maybe only 1 topic are you allowed to discuss. So when we go into a medical appointment, we need to be armed with more information. And really, it's not information, but analysis. So when we think about Dr. Surgeon, who I saw, and myself as the patient or the client, we need to do a care analysis, which is a power analysis of the situation. How was power being held over me as a patient versus handed to me? And she knew I was a physician. Maybe I got treated worse because of that. I don't know. So when I look back on what happened, I think of 4 things that Dr. Surgeon did to me. First, she ignored my woman advocate. A woman advocate, again, is someone who supports women, really anyone, going to medical appointments. So she very consciously ignored the people in the room. 2, she decided to stand up with no discussion about how that might affect me. It probably didn't even cross her mind it might affect me. 3, when I asked her to sit down, she chose not to. She completely ignored my request. She could have actually asked why or said, well, you know, I'm really sorry, but I have a back injury and I can't sit down. But she decided to ignore me in my request. And 4, she then labeled me as combative for asking for what I wanted and to try to be equalizing the power between us by standing up. When these things happen and we really have the opportunity to step back and look at how power is being shared or not, when we're in that client role, we have some choices. And those choices are called empowerment acts. Empowerment acts are any kind of behaviors, thought processes, or actions we might take that increase our power or respect for ourselves during an encounter. And we're talking about medical encounters today, but it can be in our life in other ways. So there were 6 things that I did as that client, as that patient that day, that were empowerment acts. The first thing, which I'm going to encourage everyone to do, is to bring an advocate, a woman advocate with you. A woman advocate will increase your power just by having another person in the room, someone to witness the respect or disrespect that you may experience. The second empowerment act is I didn't let her not acknowledge my woman advocate. I introduced him. She still didn't acknowledge him. The third empowerment act was to ask for what I wanted, not just to put up with poor treatment. So I asked her to sit down. I didn't get what I asked, but at least I asked, and that made me feel good about me and what I needed. The fifth thing was that I actually stood up. I took another action and looked her in the eye. I didn't hide my eyes. I looked directly at her. And I think that was something she didn't expect, that's for sure. And finally, I did not agree with what she called me, which was combative. That was not a question. That was an oppressive statement used to silence me. So when we're in a situation in medical care, we have some options. Maybe you have never thought about how you've been treated, but my guess is everyone has been treated poorly sometimes. And that's how abuse works. That's how oppression works. By alternating, in the medical setting, professionalism and this thinly disguised veil of disrespect and oppression, what I call traumatic connection. That's how abuse works, and that's how status quo healthcare works. Because we're hooked, we have to get kind of care somewhere, and we're willing to put up with disrespect to get a crumb of care because we're afraid, because we're worried, because we can't write a prescription, because we don't know what's going on with us. We don't have to tolerate this anymore. There are other ways to receive health care, to be empowered through health care. And there's two parts of this. One is us coming as clients or patients to health care and analyzing the power dynamics, analyzing the empowerment acts I can do. I could have walked out of the appointment with Dr. Surgeon. I could have just walked out and said goodbye. And we can do that. That's another empowerment act. Unfortunately, where else are we going to go? So we put up with things. On the other hand, healthcare providers, physicians, nurses, etc., can change the way they're practicing. They can slow down. They can really listen. They can believe. And they can treat others with the respect that they would want to have when they are patients themselves. So I want you to think about it very carefully. What do we have to do to change the model of healthcare, not just in this room, but around the world, and have empowerment, respect, and anti-oppression be at the heart of healthcare?